What is a patient's capacity to consent for plastic surgery? Understanding a patient's capacity to consent for plastic surgery is essential to ensure ethical and safe medical practice. It involves more than just signing a form. It's about making sure the patient truly understands and voluntarily agrees to the procedure. First, the patient must be legally competent, meaning they are an adult or a legally emancipated minor. Minors or individuals who lack mental capacity cannot give valid consent themselves. Instead, a parent, guardian, or court-appointed proxy must provide consent on their behalf. Next, the patient needs the mental ability to understand the details of the surgery. This includes grasping what the procedure involves, the potential risks and benefits, and the possible outcomes. They should also be able to appreciate how the surgery might affect their life and reason about their treatment options. For example, someone with significant cognitive impairments or certain psychiatric conditions might not have the capacity to make an informed decision. Voluntariness is another key aspect. The patient must make their choice freely, without feeling pressured or coerced by family members, friends, or medical staff. Respecting their autonomy means they have the right to decide without undue influence. Informed decision-making is at the heart of capacity. Patients should receive clear, tailored information about their specific procedure. This includes explaining the purpose of the surgery, what it entails, possible risks like infection or scarring, and alternative options, which might include doing nothing. They should also have the chance to ask questions and voice concerns before giving consent. Consent must be specific to the procedure. For example, if a patient agrees to a rhinoplasty, that consent does not automatically cover other procedures like chin augmentation. The surgeon must ensure the patient understands exactly what they are agreeing to. In the context of elective cosmetic surgery, assessing capacity is especially important because these procedures are not medically necessary but aimed at enhancing appearance. Sometimes, patients may have conditions like body dysmorphic disorder, where their perception of their appearance is distorted. Such individuals may have impaired capacity to consent because their expectations are unrealistic. In these cases, a psychiatric evaluation might be needed before proceeding. It's important to remember that consent is an ongoing process. It's not just a one-time event but involves continuous communication, checking understanding, and documentation. If a patient lacks the capacity to consent, the surgeon must seek approval from an appropriate surrogate and always act in the patient's best interests. Failing to properly assess and document a patient's capacity and informed consent can lead to serious ethical and legal issues, especially since cosmetic procedures are often elective. Respecting patient rights, ensuring safety, and adhering to ethical standards are fundamental. In summary, a patient's capacity to consent for plastic surgery involves their legal ability, mental understanding, voluntary agreement, and specific informed consent for the procedure. This process safeguards their autonomy and promotes safe, ethical practice within the medical profession. Always remember to consult qualified healthcare professionals for personalized advice and assessment.